Hey everyone, my name is Dr. Chaz Vidito. I'm a dentist that treats patients for sleep apnea as well as TMJ disorders. I'm a diplomate of the Academy of Dental Sleep Medicine, and I'm here to give you 5 questions you should ask every dentist before they treat you for a sleep-related breathing disorder. The first question you should ask the dentist is treating you for sleep-related breathing problems is, how many patients have they treated for sleep apnea? This is a really important question because some dentists try to dabble in treating patients with sleep apnea, but there's a lot of things that can happen with your TMJ, your jaw, your joints, your teeth, that you want to make sure that they're prepared to look out for and treat should they arise, as well as you want to make sure that you're seeing someone who knows what they're doing and has done this on at least a few hundred patients. The second question you should ask a dentist is treating you for a sleep-related breathing issue is, how many different appliances do they work with? There are hundreds of FDA-approved appliances that treat sleep apnea that are considered durable medical equipment, and you should make sure that they work with a wide range of different types of appliances so they can customize it to you to treat your sleep apnea as well as keep everything safe in the meantime. The third question you should ask a dentist that's treating you for sleep apnea is, are they in network with your medical insurance company? This is really important because navigating medical insurance from a dentist perspective is a nuance that they're really not always used to, as well as it's going to help you get the most coverage for this piece of medical equipment that your sleep physician has prescribed you, and they're going to also know how to work closely with your medical insurance to communicate things along the way. The fourth question you should ask a dentist that's treating you for sleep-related breathing problems is, how do they know you have sleep apnea in the first place, and how are they going to confirm that this appliance that they're making you is actually improving your apnea? So the first part of that question is, they should know how you have sleep apnea or not because you've received a test from a physician. If a dentist is saying that they are guessing that you have sleep apnea because they hear that you snore or they're seeing oral signs and symptoms of it, that is not confirming a diagnosis. A dentist shouldn't treat you for a cavity without taking an x-ray, and they shouldn't treat you for sleep apnea without you first having a test and having a consult with a sleep physician. The second part of that question is, how do they confirm that it's actually working? Once they make you an appliance, they should have a close relationship with a sleep provider that's going to do a follow-up test. So after you wear the appliance and you get some anecdotal evidence that it's working, you should make sure they're going to do a follow-up study to confirm that this appliance is actually treating your apneas. The fifth and final question you should ask any dentist that's treating you for sleep apnea is, do they have specific training in both treating sleep apnea and TMJ disorders? The easiest things to look out for are they a member or especially a diplomate of the American Academy of Dental Sleep Medicine? This means they've gone through expansive training, they've submitted cases that they've treated people successfully and gotten good outcomes. The second part of this question is, do they treat people with TMJ disorders? There is so much overlap with sleep apnea and TMJ that if they aren't trained specifically in treating people with TMJ disorders, you could run into problems that they won't be able to foresee and won't be able to treat if you start treatment with them. So make sure you ask what's their training in both sleep apnea and TMJ. If you think you might have sleep apnea, you should work closely with a sleep physician, and you should work with a dentist that has experience collaborating with physicians, working with your insurance, as well as knows certain things to anticipate along the way. I hope you found this video helpful to figure out some key questions you can ask when it comes to treating sleep apnea, specifically with a dentist who is trained to treat your sleep apnea. Make sure you ask these questions wherever you go. I wish you the best of luck, and thank you for watching.